It's a condition tens of thousands of women are talking about on social media. Yet breast implant illness, or BII, is not recognized as an official medical diagnosis.
KVUE Defenders discovered the Food and Drug Administration receives thousands of breast implant complaints a month, but that information is not easy for the public to obtain. Tonight, investigative reporter Jenny Lee shows us how an Austin woman hopes to help change that.
Do I have your attention? Do I have your attention?
When this pedicab driver catches your attention,
they would see me driving around having all this commotion.
Heidi Nicole is...
Do you like my boobs?
Hard to ignore.
I made them!
Dressed as Rosie the Riveter, Heidi's outfit also includes a bikini top with breasts made of cloth. The gimmick draws people in before Heidi hits them with her real purpose.
Have you heard about breast implant illness?
She's spreading the word about breast implant illness, or BII. The condition refers to dozens of symptoms reported by women after breast augmentation.
My brain just didn't want to work. I was very fatigued. My joints were sore.
Heidi also got bad headaches and battled depression. Symptoms she says she didn't know were connected to her implants until after getting them some 20 years ago. In 2020, Heidi says she finally found others with similar health issues.
I started finding the breast implant illness groups.
A search for breast implant illness on Facebook yields dozens of support groups. The largest has 187,000 members, all women sharing their pain and looking for help.
This is a social media phenomenon.
Dr. Shahar Khan is a board-certified plastic surgeon who only performs explants, or breast implant removals. He says BII awareness is growing, thanks in part to more celebrities removing their implants.
This is your saline implant. It's not even silicone.
On social media, Dr. Khan shows what problem implants look like. His goal is to educate more women about BII symptoms and how implants are linked to cancers like anaplastic large cell lymphoma and squamous cell carcinoma.
Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications.
Even though Dr. Khan read that warning directly from a breast implant manufacturer, he says some surgeons don't always relay that information to patients. That's why he's pushing for mandatory written informed consent, requiring a patient to sign off after a surgeon goes over all risks associated with breast implants. Dr. Khan also says as BII awareness continues to grow, public pressure will eventually lead to an official medical diagnosis. Right now,
there's no disease entity known as breast implant illness.
Dr. Scott Glassberg is the president of the Plastic Surgery Foundation, the research arm of the American Society of Plastic Surgeons. As part of the largest group of plastic surgeons in the world, he says they're conducting research to address testing and having an ongoing conversation with patients about BII treatment. Right now, there is no standard of care for BII.
How do we formalize the standard of care? How do we formalize the guidelines which surgeons should be using and patients should be following?
BII advocates point to another roadblock.
I think is really kind of missing the mark.
The Food and Drug Administration system that tracks problems with breast implants. The FDA keeps records on all medical device issues reported through its manufacturer and user facility device experience, or MOD system. A database, Madrice Kynard says, is antiquated, hard to use, and doesn't give a comprehensive breakdown of all the problems surrounding breast implants. She should know. Kynard was a public health analyst for the FDA. She helped roll out the new MOD system before leaving in 2014.
You can only search the last 10 years, which makes it very limiting because with breast implants, they've been on the market for so long and the problems have existed for so long.
Kynard says MOD only gives 500 results at a time and can only search one symptom at a time, despite many BII patients reportedly suffering from as many as 10 to 15 symptoms.
If you were trying to search for what actually happened in each of those reports, you would be sifting through data for weeks, months, maybe even longer.
That's why Kynard developed her own medical device tracking software called Device Events. She says the subscription-based service makes information about problem devices easier to access, information she wants the FDA to share with all doctors.
It's averaging 40,000 38,000 a year.
According to Device Events, the FDA received 36,820 breast implant complaints in 2019, 38,285 in 2020, 34,493 in 2021, 44,460 in 2022, 39,564 in 2023, and 3,113 last month. But on the FDA website, the agency claimed it reviewed all medical device reports between January of 2008 to June of 2023 and only identified 9,458 reports related to breast implant illness.
Are you ladies ready to use our voice? We're ready! Yes!
As Heidi prepares to officially launch her BII public awareness campaign for South by Southwest,
Woo!
she's getting help from friends who also survived BII.
There's hope for healing!
Getting loud to give help.
Don't get them!
For the KVUE Defenders,
It is time to be heard!
I'm Jenny Lee.
Well, we reached out to the FDA for an interview on this story, and a spokesperson declined, but she did answer a couple of our questions by email. You can find those responses on our website, kvue.com.